As a quick overview of the contents of this webinar, the first two presenters, Dr. Fernandez Esquer and Dr. Monfortin, they will begin by summarizing the work and the studies that led to the establishment of the Vales+Tú program. The third and fourth speakers, Mrs. Pereira and Dr. Pinzon Gomez, will focus on the components and the results of the trial. Our last speaker will address current ongoing research, which builds off of the work that done throughout the program. Now, I'll introduce the speakers for this event. Okay, first up is Dr. Fernandez Esquer. She is the principal investigator of the Vales+Tú team and an associate professor at UT Health Houston School of Public Health. During her presentation, she will be giving us a historical overview of the community engagement work completed before the creation and implementation of the Vales+Tú program. The next presenter is Dr. Celeste Monfortin. She is currently a lecturer at Texas State University and has worked with the Vales+Tú team as a consultant, focusing on occupational health. She will be detailing the research that underlied our understanding of risk and risk reduction practices leading up to the development of our program. Our third presenter, Aura Pereira, who also works with the Vales+Tú team as a research assistant, will pick up from Dr. Monfortin's presentation by going into detail about the individual and group program components within the Vales+Tú project, which are the group problem solving, and the brief motivational interview. Dr. Cesar Pinzon Gomez, the fourth presenter and a PhD candidate at UT Health Houston, will share results from the trial, sharing data about the effectiveness of our program approaches in reducing injuries for Latino day laborers in Houston, Texas. And last but not least, our final presenter of the day will be Dr. Juan Aguilera, an assistant professor at UT Health School of Public Health in El Paso. This presentation will highlight current ongoing research within the Vales+Tú team, where we are exploring the relationship between environmental exposures and the sites where Latino day laborers gather to look for work, examining how these exposures could affect the health of the Latino day laborers today and in the future. If we have time after each presentation, we will take 1 to 2 minutes. We will take 1 to 2 brief questions through chat. We will also be having a Q&A session after all of the presentations. We will take those questions through chat, or once we are in the Q&A session, you could virtually raise your hand by clicking reactions and then voice your question to the team directly during your turn. And now we will begin the seminar by going to Dr. Fernandez, if you're ready.
Ana, can you hear me?
Yes.
Okay. Good afternoon, everybody. My name is Maru Fernandez, and before the rest of the presenters give you the details of the work that we have been conducting regarding the injury program, I would like to provide you an overview of our work. It's a little bit of an historical perspective, and I will emphasize community engagement strategies, as well as some of the information that we have collected regarding reducing injuries at work. Next. Before I discuss with you strategies, let's talk a little bit about who are day laborers. Latino day laborers are Latino immigrant men who congregate at public places like street corners, bus stops, gas stations, and home improvement stores. At these locations, they solicit daily or short-term jobs, mostly in the construction sector, and they are hired by contractors and subcontractors and by individual homeowners. From a public health perspective, Latino day laborers are a vulnerable population because they work in dangerous circumstances. In the United States, national data indicates that in the 10-year period between 2011 and 2021, Latino workers' deaths increased from 19.8% to 27% in the construction sector. In Texas, the construction industry accounted for most of the fatalities among foreign-born Latino workers. So of the 134 fatalities, fatal injuries in this group, 55 deaths, or 41%, occurred in the construction sector. This represents a rate of 1 death every 2.5 days. Next. I think you went backward, Anna. Yes, thank you. So what are the factors that contribute to workplace injury? There are many factors, but what we group the most important factors under 3 categories. So there are structural and contextual factors that contribute to injury. Unsafe work sites where they are employed, the lack of personal protective equipment or safety training provided by the employers, and receiving below poverty wages or experiencing wage theft. Precarious living conditions also contribute to injury. So poverty, low levels of education, and a limited ability to communicate in English contribute. And very importantly, for many day laborers, the recent immigration experience also contributes to the risk of injury. Finally, as a result of their conditions, they often suffer from mental health problems. So high stress, depression, isolation, and participating in substance abuse also contribute to the experience of injuries. Next. So one of the things that I would like to emphasize is that from the very beginning, we have emphasized a culturally grounded and participatory approach. And there are many activities that fall under this category, but today I would like to emphasize 3. So the first one is that we have been able to partner with Latino day laborers, labor activists, city officials, academic researchers to collectively lead the study. All of these constituencies have been part of our community advisory board at one point or another. In addition, we have organized the CAB as a set of small working groups that are charged each with monitoring progress of key study activities. So that, for example, in our earlier studies, we had an intervention development working group and a focus group working group. Lately, we are working with the dissemination work group to share the results of our program. The final strategy that I want to emphasize today, and you're experiencing it right now, is the fact that we partner with a group of simultaneous translators, which I want to thank, because the group that is doing the translation today works with us pretty much on a weekly basis. So simultaneous translation facilitates the engagement of Spanish monolingual and English monolingual speakers so that all of our teams, everybody participates equally and there are no issues of delays due to translation. And this contributes to language justice as well as good communication in our team. Next. So this picture that you see right here are the members of the Community Advisory Board. The picture is not new. It dates for a few years ago. And many of the people that you see here have moved on. They're no longer working with us. But some of the people that you see here are still working with us to the present. And the names of the research team, community partners, consultants, and the day laborers that have worked with us, some of their names are here. And so this represents the group that works with us. Next. Another engagement strategy that I would like to emphasize is adopting different ways to listen to Latino day laborers. And so the strategies that we have adopted to facilitate equal exchange include the adoption of participatory strategies that are based on popular education methodology, including interactive games, storytelling, and group dialogue. The picture that you see right here shows members of the outreach team working with a group of day laborers in explaining injuries at work. The image that is being highlighted on the floor is a puzzle that the day laborers have put together, and examples of strategies like this have been very successful in getting the workers to engage in our program and share their experiences with us. Another strategy that we adopt is the respect for worker self-determination. In the context of our intervention research, this means that we see our work as partnering with the worker and facilitating their ability to identify problems and identify solutions, and very importantly, the strategies to resolve problems of dangers at work is pretty much up to them. Another strategy that we emphasize are cultural practices such as sharing a meal, like taquitos. We emphasize humor in our communication with them. We highlight their own worker experiences and their ability to problem solve together or as individuals. Finally, another strategy that has helped our work a lot is that we maintain rapport through frequent visits to the corners to discuss corner issues. And so whenever possible, we go visit and try and get an idea of what is going on at their own corner location. Next. Okay, this image right here gives you the dates for the 5 different studies that we have conducted with Latino day laborers, of which only the last one indicated here with the date 2025, even when it started in 2023. It's a COVID study that is not going to be discussed today. And so for the 4 studies that you see on this picture, what I would like to say is that the early methodology that we began to develop since 2008, we then refined it in the study that was completed between 2013 and 2015. And it led to many of the methods and strategies that were adopted in the clinical trial that will be discussed today. Next. So the only thing that I would like to emphasize of the data that we have collected, you see right here, 7 different points of data collection. I would like to emphasize the reported injury provided by the laborers over the last year. This is information that is not reported very often, and so I would like to highlight it for you. So as you see in this bar graph, reports of injury vary from 18.34% of our study participants all the way to 41.62%. And if you average reported injury across studies, the average is about 27% of participants reporting an injury in the last year, which is 1 in every 4 jornaleros report an injury. This is high, but it is also consistent with what has been in other reported in other studies around the country. Next. Okay, so I would like to highlight for you today some of our accomplishments as indicated by the activities that we have conducted. So over the 2008-2023 period, which is more than 10 years, by the way, we have conducted 2 randomized trials, a pilot randomized trial completed in 2015, and the most recent clinical trial. In these 2 trials, we have enrolled a total of 392 day laborers who have participated in our activities. And also during this period, we have collected data from 2,112 day laborers in 7 separate surveys. I also want to highlight some of our dissemination activities. At the end of our second trial in 2023, we disseminated study results by providing over 2,000 brochures at 31 day labor corners. And as we distributed those brochures, we also formed small group discussions in which 1,107 jornaleros discussed how to reduce dangers at work. Next. So over these different studies, there have been lessons that we have learned about severe injuries. I'm just going to highlight a few things that have been presented in our publications, which are listed at the end of my presentation. And so we have found that at the proximal level, the occupational environment indeed influences report of severe injury. And so we have found that exposure to chemical compounds and to hazardous work conditions contribute to the report of severe injury. But also we have found that at the personal level, demographic characteristics sometimes are related to severe injury. This means that the influence of demographic is inconsistent, so that age, education, and marital status sometimes contribute to injury and sometimes not. At the macro level, we have found that immigration and adaptation stress influence hazardous exposures that lead to reported injury. And finally, structural racism, as measured as perceived discrimination and wage theft, influences severe injury directly, but also indirectly through its influence on mental health. Next. Okay, so to conclude, I just would like to summarize a few lessons that we have learned in our studies, so that we have learned that participatory community programs are effective for several reasons. They are effective because the research that is grounded in mutual and fair engagement and the right of workers to advocate for themselves increases the validity, acceptability, and effectiveness of safety programs. We have also found that developing programs jointly with day laborers increases everybody's task accountability and a sense of ownership that contributes to program success. And finally, cultivating a continuous engagement with Latino day laborers increases camaraderie between everybody involved, a sense of empathy, and a sense of collective achievement for everyone. So I am done with my presentation, and I will let Dr. Monforton tell you more about our formative research. So thank you very much.
So thank you so much. This is Celeste Monforton. I'm joining you from San Marcos, Texas. I'm going to talk about the structured conversations that we had with Latino day laborers in Houston, which were used to inform both the purpose and the design of the subsequent studies, the culmination of which you just heard from my two colleagues, Dr. Gomez and Ms. Pereira. When this project started in 2007 and 2008, we really needed to engage with day laborers because we didn't know a lot about this population. And so, Anna, you can go to the next slide. What we did was we recruited day laborers to participate in focus groups and in in-depth interviews. And those conversations covered a broad range of topics on the kind of work that they do and their living conditions. Next slide. I think it's the next one after that, Anna. I can see it at the top, very small. So just a little bit of those findings from the focus groups and in-depth interviews in 2007, 2008. If we go back to that time, among the participants who were not authorized to work in the U.S., some felt that they had been deceived about the economic opportunities in the U.S. One gentleman said, "You come here thinking that doors are going to open, and all of a sudden you find yourself at the corner." There's stiff competition at the corners from other men who are in the same situation. There's a lot of uncertainty about whether jobs will be available that day or what kind of work will be available. The day laborers also talked about some of the abuse that they experience from employers, everything from verbal abuse to being denied water or not being paid. These conversations also helped us understand their reality in the sense that how they cope with the situations that they're in. So one small example is the importance of maintaining self-esteem. And we know that there's dignity that comes from work. And for these men, what we heard was the responsibility for providing for your family. And as a way to maintain, we view that as a way to maintain self-esteem. Another comment was that they're bringing a benefit. They have value in their work, particularly because they're doing jobs that others, particularly white people here in the U.S., would not do. Next slide. So 7 years later into our research, it had really evolved. We came to understand this community of workers much better, but we wanted to learn more specifically about the hazards that contribute to work-related injuries so that we could develop a meaningful intervention. So we intentionally sought out day laborers who had suffered an injury in the previous 6 months. And we were specifically looking for serious injuries, which we defined as the day laborer had missed at least 1 day of work because of the injury, or they went to work when they really thought they should have stayed home because they were injured, or they had received medical attention from a doctor or a clinic. And we conducted focus groups at restaurants that were close by the corners. This was convenient for the day laborers, but it also was consistent with our value of being able to share a meal with the day laborers and the research team. We used 2 specific methods to elicit information from the participants. For the risk mapping activity, we asked day laborers to divide a piece of paper into sections. And in 2 of those sections, we asked them to draw or write down something that is a hazard at the place where they work. And then we discussed what they had on their papers, or they discussed what they had in their papers. Next slide. So these are some of the examples that the Latino.
Please go a little bit slower for the interpreters.
Oh, I apologize. These are examples of the hazards that the jornaleros talked about. And you'll notice under risks on the job, the first bullet, these are hazards that are common in the construction industry, which in Houston is much of the work that day laborers are hired to do. You'll also see that not having proper tools or not having training were things that they identified as being risk for serious injuries. This risk mapping activity generated a lot of interesting discussion. And also the participants commented that they really learned a lot from it. To paraphrase one jornalero, translated from Spanish, we are at the corners to look for work, but we don't remember all the risks. It is only now when we are having this talk that we recall the risks. So certainly we heard a lot of shared experiences among the jornaleros, but there were differences in their points of view. Just one example was a conversation about who was responsible for safety on the job. Next slide. At the top bullet, it says the boss does not know whether or not I can use that tool. Therefore, the risk is on me. It's on the day laborer. In contrast, another said, sometimes you go without even knowing what time of work needs to be done. Therefore, the responsibility should be on the boss. After the risk mapping activity, we gave the participants another piece of paper. And remember, this is all taking place in a restaurant with a silhouette of a male body. And we asked each of them to mark all the areas on that body where they had been injured. And then we invited them to talk about how the injury happened. Next. We found that having that silhouette generated really dynamic conversation, a lot of rich details about the incidents, including disclosure of sensitive topics such as close call incidents that could have been fatal. One gentleman talked about getting struck and injured by a piece of plate glass, but you could tell he was very traumatized by that because it could have been much worse. And also not disclosing to family members that they actually had been injured. We had transcripts from all of the focus groups, and we analyzed those. And it was really enhanced very much because we had former day laborers assisting with our analysis of the transcripts. They really helped put the day laborers' stories into context. The participants had different perspectives on decision-making about performing hazardous tasks versus earning a living. For some, the need to earn a living superseded the decision about dangerous work, while others disagreed. One participant said, and translated from Spanish, he said, "I will not lose an eye just to make $100. Next slide. Because besides the conversations about hazards and injuries, we noted a variety of strategies used by day laborers to cope with work-related risks. And these are the ways that we categorize them. For example, knowledge, social network, and personal values. On the next slide, I just give a couple of examples from the knowledge category. This day laborer is talking about a conversation with a boss, and he said he told the boss, "If you give me the right tool to cut, I would have finished it, but you leave me here cutting cement with this knife. How can you expect me to be productive?" The second example, the jornalero said, "I took a course in asbestos removal, and then an American brought us to a home to remove the asbestos, and I knew how to do it. So I told my coworker how he was supposed to remove it and discard it." So within that social network, this strategy illustrates that if your coworker doesn't know how to do a job safely, they could get hurt, but you could also get hurt. What we learned from the day laborers in this formative research, these conversations, we used it in numerous ways. We improved our survey instrument. We were able to have a set of strategies that had been discussed with the day laborers previously about hazards. We created a really cool injury booklet that we used in the needs assessment phase, which was prior to implementing the pilot clinical trial. And in that injury booklet, which was used on the corners with the promotoras, it included that male body silhouette and the body mapping activity. So in conclusion, through our formative research, we found that Latino day laborers absolutely knew that their jobs placed them at risk of serious injury. By hearing their stories about being injured, we learned much more about the hazards that they face and their strategies for addressing them. A really important lesson we carried into all of our subsequent projects is that day laborers are not a monolithic group. Like other workers, like all of us, they have different life skills from each other, different job skills, different strengths and vulnerabilities, and different perceptions of risk. And I'll say that this is something that has guided the design of the Vales+Tú project, and in particular, the clinical trial, which Dr. Gomez reported on. So thank you so much.
Thank you, Dr. Monfortin. Does anybody have a quick question before we move to the last presentation of the day? You can put it through chat or you can voice it out loud, whatever your preference is. Okay, somebody in chat, I don't know what your first name is, but Falknor is your last name, is interested in, is wondering if we could be interested in expanding the focus and the reach of our work to other worker populations. So Dr. Fernandez and the rest of the team, if you would like answering that question.
Hola, saludos a todos. Mi nombre es Aura Pereira, soy parte del equipo y hoy vamos a hablar acerca de la implementación de un programa para reducir riesgos laborales en los jornaleros latinos de Houston. Siguiente. Para comenzar, quisiera contarles un poco acerca de qué es Vales+Tú. Vales+Tú es un programa de prevención de lesiones dedicado a la promoción de la salud en las esquinas donde los jornaleros latinos están buscando trabajo. Y su objetivo principal es promover la salud y la seguridad de los jornaleros y reducir sus lesiones durante el trabajo. Es un programa que fue desarrollado en Houston con la participación comunitaria y comprende 2 implementaciones que toman en cuenta la cultura, el contexto y las necesidades de reducción de riesgos de la población de los jornaleros, además que también puede ser adaptada por otras organizaciones de todo el país. Siguiente. Quiero comentarles acerca de nuestro programa de implementación. Se divide en resolución de problemas en grupo, a través de aprendizaje y acción participativa en grupos pequeños y entrevista motivacional breve, una conversación enfocada en el cambio individual centrado en la reducción de riesgo. Quería que prestaran atención un poco a la foto que vemos en el grupo, en la resolución de problemas en grupo. Como ustedes ven, estamos en la esquina, que a veces tenemos que adaptarnos un poco a las condiciones que tenemos en las esquinas. Como ven allá en el fondo, es un contenedor. En ese contenedor donde dejan la ropa para regalar, allí es donde nosotros colocamos los papelógrafos para comenzar el trabajo con los señores, adaptándonos también a las condiciones de ellos. En el lado derecho pueden observar una foto de una de las compañeras que está dando la sesión de de la entrevista motivacional breve. Siguiente. Ok. Resolución de problemas en grupo se realizó en las esquinas de Houston con 100 trabajadores. Es una actividad que está basada en una metodología de educación popular aplicada en grupos pequeños de 5 a 6 personas. Y el objetivo es promover la concientización y la planificación acerca de la seguridad en consenso con los grupos. Se buscaba animar a los jornaleros a trabajar juntos para identificar estrategias y soluciones a los problemas de seguridad que surgen trabajando. Siguiente. Los pasos que busca crear es una actividad que busca crear un espacio seguro de confianza para que precisamente los jornaleros pudieran sentirse cómodos de hablar acerca de todos los temas que teníamos propuestos para ellos. La segunda actividad que llevamos a cabo era identificar riesgos para poder conocer las 2 preocupaciones más comunes que estaban relacionadas con la seguridad en el trabajo. Siguiente. Luego de que hacíamos todo esto, aplicábamos la estrategia llamada el COMPA. El COMPA se usa para promover la reflexión entre los jornaleros acerca de cómo reducir los riesgos en el trabajo y con el trabajo en equipo. COM, si lo vemos de esta manera, COM significa comunicar, P, planear y A, actuar. Y finalmente, trabajamos nuestra última estrategia llamada nuestra promesa para desarrollar un plan de acción colectivo e individual con pasos concretos para evitar los riesgos en el trabajo. Siguiente. Vamos a hablarles ahora acerca de nuestro programa individual, entrevista motivacional breve. Se realizó también en las esquinas de Houston con 100 trabajadores. Fue un método enfocado en el trabajo individual, ya que se realizaba esta entrevista con cada participante. Y su objetivo principal era aumentar la motivación de cambio a través de un proceso que explora y trata de resolver sus ambivalencias. Cada una de estas sesiones estaba guiada por un promotor de salud y duraba entre 30 a 45 minutos. Se le hablaba al trabajador acerca de los riesgos en el trabajo y los factores que influyen en ese riesgo, percepciones de riesgo de lesiones, normas sociales y autoeficacia. El resultado de esto era un plan de cambio cuando el jornalero tenía la motivación a cambiar. En la foto que vemos a la derecha observamos cómo nuestra compañera está conversando con uno de los señores precisamente para llevar esta actividad de entrevista motivacional breve. Siguiente. Voy a mostrarles ahora el paso a paso de esta actividad. Lo primero que hacíamos era hacer una introducción para conocer qué significa la seguridad en el trabajo para cada participante. Luego, hablábamos acerca de la importancia de evitar riesgos y de cuidarse, para después identificar qué es lo que hacía la persona para cuidarse en el momento actual en el que se hizo la entrevista, y después se le preguntaba acerca de cómo podía cuidarse en el futuro. Con esta información ya pasábamos a elaborar un plan de seguridad basado, por supuesto, en la estrategia del COMPA, que ya sabemos que es comunicar, planear y actuar para promover la reflexión entre los señores con esta estrategia. Cerrábamos, por supuesto, con mi promesa, que es un plan de acción con pasos concretos para evitar los riesgos. Como nos damos cuenta, en ambos programas, tanto el individual como el grupal, usamos dos estrategias principales que fueron el compa y mi promesa. Siguiente. Quiero mostrarles ahora mi promesa con una foto que tenemos acá en donde uno de los señores tiene esta tarjeta que ustedes observan a la izquierda y en esa tarjeta el señor se comprometía cuáles eran los cambios que quería comenzar a poner en práctica para poder cuidar su salud y evitar los riesgos laborales. Los objetivos principales de esta promesa, pues, era un plan de seguridad, identificar los cambios a los cuales el señor quería comprometerse y hacer su compromiso público, que lo hacía de manera escrita, como lo estamos observando acá. Para finalizar, quiero compartir con ustedes algunas imágenes en donde ustedes pueden observar cómo se hace el trabajo de campo. Estamos observando la primera imagen en donde uno de los compañeros está haciendo la entrevista motivacional, adaptándonos a los espacios de las esquinas, porque las esquinas tienen también su propia forma y nosotros tenemos que adaptarnos a ellos y a las esquinas. Vemos en el centro a una de las compañeras también realizando la entrevista y finalmente el señor firmando la promesa. Voy a compartir con ustedes también un breve video. En este breve video observamos en principio cómo nuestro equipo está primero implementando la encuesta para luego comenzar con tanto el programa individual como con el programa grupal. Observamos cómo nos vamos adaptando las esquinas, cuál es la situación en la cual están los señores, de qué manera nosotros también les damos a ellos la facilidad para que puedan trabajar en conjunto con nosotros con el programa, poder disfrutar y conversar con nosotros acerca de todas las estrategias, como lo vemos acá. Y bueno, ya estamos finalizando prácticamente todas las actividades, siempre finalizaban dándole una tarjeta de regalo a los señores en agradecimiento por el tiempo que ellos nos prestaban. Así que esta ha sido toda la presentación por el día de hoy. Mi nombre es Aura Pereira. Muchas gracias.
César.
Okay, can you hear me there, Ana?
Mhm.
Excellent. So thank you, Aura, for that excellent presentation. Good morning, everyone. My name is Cesar Pinzón Gomez, and today I will be showing the results of the 2021 cluster randomized trial. So to start, we need to answer the question, what is the purpose of the study? The purpose is to test whether the program is effective in helping laborers to reduce workplace exposures and hazards. On a short term, the goal of the study was to reduce exposures to workplace hazards by involving Latino day laborers in a corner-based safety program that addresses how to reduce dangerous conditions at work. And on a long term, the goal of the program is to help Latino day laborers to reduce their risk of injury at work. So how do we make this study? This is a process that has 3 components or steps. The first step is to select the study design. For Vales+Tú, we chose what's known as a cluster randomized trial. And what does this mean? The word cluster is related to the fact that we selected corners for the study, and randomized trial means that the clusters or corners were assigned at random to the programs. In addition, This study design means that we're going to compare the effects of both the individual program, which was based on brief motivational interview, and the group program, which is based on group problem solving, with a relatively simpler intervention called the control. This control intervention is handing the laborer with an informative OSHA safety card with information about health and safety at the workplace. Another component is corner selection and assignment to the interventions. We identified corners in the Houston area. However, these corners differ by their size, so we classified them into small, medium, and large corners. Our goal was to have a representative sample of at least 300 laborers from at least 30 corners. So with the candidate corners identified, we started to randomly select corners that would be included in the study. And we also began the process of randomly assigning them to each of the 3 programs of the study. I'll briefly explain the randomization process. So first, we have identified all the small, medium, and large corners. And using a computer program, it designates corners from all sizes to the control, individual, and group programs. This way, each program gets 10 different corners from which we will recruit at least 100 laborers. By combining all the groups is how we get our sample of 300 participants from 30 corners. Finally, the third component of the study is the survey, which contains the instruments or questions that we ask the laborers to assess each program's effects. We have 3 types of questions. Questions about exposures to hazardous chemicals, which assess how frequently laborers are exposed to certain chemicals, such as paint thinner. We have questions about hazardous working conditions to assess how frequently laborers engage in jobs with hazardous working conditions, like, for example, the risk of falling. And finally, we have safety practices questions. We have 3 different measures. We have preparation safety practices, which assess how frequently laborers prepare a safe work environment. For example, securing the area before engaging in a job. We have harm mitigation safety practices, which assess how frequently laborers take action when they identify a hazard. For example, refusing a job due to a safety concern. And finally, we have proactive communication safety, which assess how frequently they communicate with other laborers for safer work environments. For example, asking the coworkers for help in completing a task. So how do we apply these questions to get the data we need to test Vales+Tú? I'll explain. Let's say we're at a corner assigned to receive the individual program. We recruit the laborer and apply the survey with the questions. This is known as the baseline survey. Once it is complete, we start the individual program activity, the brief motivational interview. We then wait 30 days in which there might or might not be changes for the group, and we call the participant by phone to apply the survey again. This is known as the follow-up survey. We expect the intervention to have an effect in reported exposures and working conditions that is reflected in a change in the follow-up survey. By measuring this change, we can assess whether the individual program had an effect or not in reducing exposures, hazardous conditions, or safety practices. The process is exactly the same for the group program, with the only difference being that after the baseline survey, we conduct the group problem-solving activity. And for the control group, we hand them over the OSHA safety card. This way, we get baseline and follow-up data for each program to assess the effects of each and then compare them. So now that we know about the study, how we did it, let's talk about the results. This table shows the scores for reported exposures, working conditions, and safety practices for all the 248 participants who completed both the baseline and the follow-up surveys, regardless of the program they received. So how do we read this table? Well, let's focus on exposures for a moment, and we can see that in our sample, the mean score of reported exposures at baseline was 1.63, and at follow-up, it was reduced to 1.44. The p-value tells us that this difference is statistically significant. The same applies to reported working conditions, where we observed a significant reduction from baseline to follow-up. Conversely, although there were changes in safety practices scores from baseline to follow-up, these were not statistically significant. In our next slide, I will break down the data for each of the programs we implemented, but overall, the interpretation is the same. So here's the same data, but we broke it down by intervention. Here we can see that at follow-up, there was a statistically significant reduction in reported hazardous exposures for the group program and the control. Additionally, we can see that all programs had a significant reduction in reported hazardous working conditions. Regarding safety practices, we did not see any significant changes. In our next slide, I will compare the relative change of each intervention. So this table is a little different. It shows us the relative changes in the scores as a percentage, using the baseline score as the reference. So for example, for the group program, in the previous slide, I showed that, for example, that the baseline score was 1.71 and the follow-up score was 1.44. This means that after receiving the group program, we observed a reduction of 15.8% in the reported exposures. The negative sign reflects a reduction. We compared the relative changes of the programs with the control group and found two statistically significant differences. First, when we compare the individual program with the control, we observed that for reported exposures, the individual program had a smaller reduction of -5.1% when compared to the control group's reduction of 15.4%. The second significant finding was observed when we compared the group program with the control. And we saw that for working conditions, the group program had a greater reduction of -17.3% when compared to the control group of -9.7%. For safety practices, we observed no significant differences between the groups, but we observed a marginal difference between the control and the group program. So after looking at these results, what are our conclusions? Well, first, that all the three programs helped to reduce the exposures to hazardous chemicals and hazardous working conditions at follow-up. The individual program showed less significant reduction in exposure to chemical hazards when compared to the control. The group program showed a greater significant reduction in exposures compared to hazardous working conditions in the control. None of the programs showed significant changes in safety practices. So all these findings highlight the importance of implementing programs at the corner to help laborers in obtaining information to reduce risks at the workplace, resulting in the prevention of work-related injuries. This concludes my presentation of the results of the 2024 Vales+Tú cluster randomized trial. And as you can see, the results are very summarized, but if you want to see additional data, we're more than happy to share it with you and have a deeper discussion. Thank you very much.
Thank you, Cesar. If anybody has a very brief question, we can answer it through chat. Celeste, would you mind speaking to see if your mic works right now?
Yes. Can you hear me, Anna?
Yes, I can. Okay.
I think it's great if anyone has any questions about what's been presented so far. We'll just take a moment, let you write a question in the chat if anyone has one.
Time, I'll move to your slide, Celeste.
Hi, I have a I'm just wondering, like, what is the limitation of this study? I don't see that is presented here.
Dr. Fernandez, you want to take that question?
Hi, thank you for your question. So you want to know the limitations of the randomized trial, the recruitment? If you can tell me more about it, I can provide you with a more specific answer.
The last one that you showed, the individual study and the group and the control group.
Oh, okay. Okay. So first of all, this is the first time that we implement the program. At this point in time, the limitation is that this is a very new program that we're still testing out in the community. We recruited participants at random. There are no immediately obvious limitations that we can see to the program. It was formally tested in an experimental trial following all of the protocols for an experimental trial. But then again, it's a small test of our program. The additional limitation would be that it is appropriate and applicable to the local population, and to be able to generalize it to other populations, we would have to implement it and test it again.
Okay, so you're saying that that this one is based on Houston, so and very small population of 300 people. So you're saying that is it going to be generalizable to other parts of the country where they have Latino laborers?
To the extent, yes, I'm sorry. Yes, to the extent that day laborers have similar characteristics to the Houston day laborers, yes. But like I said, we will not know until we test it again. In principle, and following the principles of an experimental study, in principle, I would say that yes, the results that we got in the study can be applied to other groups of day laborers in the country.
Okay. I will interrupt you right now because we need to move on to our next presentation. So Dr. Monfortin, if you're ready.
Yes. And I see we have some great questions in the chat that we will be able to get to.
And
Can
if
you
we
hear me?
don't, yeah,
Can
we
you hear me all right, Anna?
Yeah,
Okay.
we can. But
Great.
before you continue, we will answer those questions. If they're not answered during the short, brief Q&A sessions between presentations, you will answer them at the end. So if you can stay, please stay. We will answer your questions eventually.
Sorry, I was still playing with the camera. Thank you, Dr. Feldner. I'll answer this very quickly so that we can have our last presentation and allow Dr. Aguilera to do the final presentation. I think that many of the strategies in terms of engagement with the workers, particularly our ability to engage in public places and establish rapport with them and incorporate and invite and partner with different members of the community, particularly communities that directly work with other workers, is very important. It has worked with us very well. And I personally have adapted these strategies to other populations of contingent workers, and they seem to work well. And I would be happy to expand on that maybe later after the final presentation.
Thank you, Dr. Fernandez. Dr. Aguilera, if you're ready.
Thank you so much, Anna, and for the team. Can you hear me okay?
Your audio is a bit difficult to understand right now.
Let's see. Is this a little bit better? Excellent. Well, thank you so much for being part of this webinar. I think we're all been learning from the conditions, the day laborers, and I would like to follow up with a little of a different angle in this case, in which we're also characterizing the environmental exposures at the day labor corners. And this is work that we're doing in conjunction with everything that is done through the observations, and I'm happy to share a little bit more Anna?
Give me 1 second. The interpreters are still having a difficult time trying to process. Is there a different way you could have a microphone on?
I
Just to
am
make-
using my headset, but let me change to the one for the
Okay, thank you.
How about this? Is this better?
Susana? Okay, yes, you're good.
Excellent. So I'll just speak louder to my computer and that should make it a little bit easier to follow. And thank you so much. And also if there's questions en español, después también estoy feliz de contestar preguntas si por alguna razón se pierde en la traducción. Next slide, please, Ana. So taking into account the vulnerabilities of the urban day laborers, we also need to consider the environment. And in this case, urban areas are exposed to several environmental stressors, whether it's air pollution that's coming along from vehicles and traffic, or air pollution coming from the industrial activities, and also the urban heat island effect. So next slide, please. These are some key concepts I would like to make clear to everybody during the presentation, because when we're talking about the urban heat island, what this means is that despite what temperature is recorded in any weather application or report, when you're located within an urban environment, the perception of the temperature is going to be higher. And this is very important because most of the day laborers are working within an urban setting. And often the landscape we have in Houston has a lot of buildings, a lot of asphalt, and that also can make the perceptions of the temperature even higher. So it's very important to consider the laborers' conditions and that they usually work within these settings. And another aspect is PM 2.5. What we mean by this is particulate matter, which are smaller than that. It's okay. So when we talk about these particles, it is very important to consider that the particles are coming from vehicle emissions. Previous slide, Anna, please. When we talk about vehicle emissions, they're coming from through your respiratory tract as you're breathing the amount of particles, and these can go and cause things beyond asthma attacks and bronchitis. You can also have irregular heartbeats, heart attacks, and all of this is because these particles are small enough to go beyond what we breathe and get into our system. And being located in corners that are usually close to intersections, we can see that these emissions can impact the day labor corridors. Next slide. So we wanted to look into the spatial relationship between the day labor corners and some of these risk factors in Houston, which is an urban landscape with several activities related to industry. And to give you an example, here in the map, we're seeing the overlay of Houston and also heavy traffic roads located within the county. And each point you see here corresponds with one of the corners where the day laborers gather in order to look for work. So we can already see that there is overlap with major roads. Next slide. So we identified through the field observations and community input, as you saw from the methodology that has been implemented throughout this webinar. And we consider a subset of 730 individuals that were observed in average during 2019 and 2023. In the map located here, we can see a heat map that is basically talking about the amount of day laborers that was observed at these corners. And you can already see there are some clusters in the central areas and also in the southwest, where there's a higher number of day laborers that gather. This is important because we can visually identify some areas where they might be an increased exposure to environmental risk. I would like to make note that this is just based on the observations, but it doesn't account the average of 2,000 to 3,000 day laborers that are working in the area. So it is just based on the observations, and it's not a full representation of the amount of day laborers that we know in the area. Next slide. So in order to do this assessment, we wanted to use the geospatial analysis to integrate things related to the environment. In this case, PM2.5, air pollution, which I mentioned, are the particles that we breathe because of the vehicles or construction sites and go into our system and relate to health effects. We wanted to pair this data also with traffic data because from the maps that we see in the upper section of the slide, the amount of air monitors is limited compared to the amount of traffic data we have available in the city. So this allows us to make a comparison between traffic and air pollution data, and then overlay that with the corner information. And then also, we use the results of a heat mapping campaign that allows us to see what are the urban heat island effects in the morning conditions where most of these day laborers gather in order to wait for an offer of employment. So we did 2 overlays with different maps. And in the next slide, I will show you the results. So our findings indicate that these corners align with high traffic densities, which also correlates with PM2.5 exposure. This means that as the higher amount of traffic in a certain section is recorded, that also it's related to the amount of air particles that you can breathe within a certain area. So the map on the left of the slide is going to be the relationship with traffic, and each of the black dots represents a corner where the day laborers gather. So the greater the circle, basically the greater amount of traffic counts that has been recorded within 1 mile of that site. And we can see that many of them do correlate with a vast amount of traffic at that section. And we can see that basically the areas in the west and southwest are also having records of higher amounts of traffic. And we can go to the next slide so people can see the translation in Spanish, while I'll describe the second map, which is going to be located in the right side. In that one, we're seeing the relationship with the urban heat. We had a little bit more of a limited information for the mapping campaign, which only covered the central parts of the county. But in this case, we can see that within the central and southwest areas, the relationships with the urban heat tend to be greater in corners located at this section. So this is really important because we can already see that there's some areas that do have a greater temperature when they're compared to the temperatures from the other regions. So next slide. We would like to make a point that addressing these exposures to urban planning and public health initiatives is crucial because even due to their conditions and the amount of injury that these day laborers are exposed, adding also the environmental aspect, it's something that is going to impact their health. We can mitigate this risk by promoting safer environments and monitoring air quality, temperature, and of course, implementing green infrastructure. But we can also mention that we do want to learn more about how this is impacting the health of the day laborers. So we are already in talks of considering how can we pursue answering some of these questions. And with that, I also want to thank everybody for staying in, and we're going to be happy to answer any feedback. Next slide, Anna. And this will be the conclusion of our webinar presentations. I would like to invite the other speakers also to turn on their cameras as we prepare to answer your questions. And thank you so much for your attention, and remind everybody that we're here to learn from each other and to find ways to improve our community. So thank you so much for your attention.
Thank you, Dr. Aguilera. Like everybody, like he just mentioned, if you would like to post your questions in the chat or go through to the reactions and raise your hand, we will alternate between the two. But I guess we should start with one of the first questions. One of the first questions that was asked in the chat is, can we speak to the injuries reported pre and post intervention? And I open that up to the team.
Sure, I can answer that question. So we did ask questions about having injuries. There are some challenges in collecting this data, but to summarize everything, we asked whether they had a serious injury in the previous year at baseline. And we also asked if they had a serious injury at the follow-up, also within the 1 month after we made the baseline. So what we saw was that in general, for all of our sample, we did see a reduction in the proportion of laborers who reported an injury. So we went from 16% at baseline to 13% at follow-up. But this difference was non-significant. When we identified or when we studied the serious injuries by each of the programs, we did see that for the group program, there was a significant reduction in the reported serious injuries in the previous month. So yes, we did ask it, and perhaps one of the, for this specific point, and perhaps as a way also to answer a previous question about limitations regarding injury, there are limitations because we do not know how much time the laborers are working. Their working hours vary very much. They vary very much. So we cannot calculate injury rates. We just stuck with reported proportions. So we cannot be specific on the real impact or how to get a number to compare it with other types of injury rates that are reported in literature. So that is basically what we have about injury for our sample. But yes, we did ask about it.
Thank you, Cesar. Up next, if somebody doesn't come in through the reactions, Dr. Fernandez Sanchez asked if we noticed that most of our data collectors are women and participants are men. How did we navigate potential power imbalances and gender dynamics? And I think the field team can speak to this too, but Dr. Fernandez or Cesar, would you like to speak about it first?
I think I can take that question, Anna. Thank you, Dr. Fernandez Sanchez, for that question. Very thoughtful question. I would like to clarify that even when most of our interviewers were women, we also had three male interviewers as part of our team. We also had the group intervention, and the individual intervention delivered by men as well. And so to answer your question, I can only provide an answer based on observation. And it sounds to me that based on what the interviewers reported and what I noticed in the intervention program, there did not seem to be a clear pattern. It looked like the engagement and the disclosure seemed to be relatively equal across male and female interviewers, but I would say in some cases it looked like there was more disclosure and a greater attempt to ask for assistance from the female interviewers. And so to some extent, we were aware of that, and we encourage all of the interviewers to be aware to the need to provide participants. And this is something that we can pose as an empirical question later on. Now, I believe that your next question was, how did we address participants who were willing to avoid risk but did not have the right equipment? The intent of the program was precisely that one, to encourage participants to take steps to reduce risk. So both the individual program and the group program had a final statement at the end, a commitment to change statement that we call Mi Promesa, where we asked the participants to indicate what they would do to reduce dangers at work. We did not specifically focus on safety equipment And we understand that this is often something that the employers do not provide. And so later on, as part of our dissemination campaign, we did encourage them to talk, to communicate, and to plan to bring equipment, but it is clearly something that is more in the context and in the hands of the employer, even when we do encourage the workers to request it as well. Now, your last question, did you find resistance in using gift cards? The gift cards, negotiating the amount and the distribution of gift cards obviously was discussed with our funding agency, the National Institute of Minority Health Disparities, but it was also approved by the Community Advisory Board and the Committee for Human Subjects at the university. There was no resistance on the part of the laborers, and most of the time they seem to be very thankful for the gift cards. Now, your final question is participants with college education. And I have to tell you, there were very, very few participants with college education among the laborers. And to be able to tell you anything about their performance in the trial, we will have to look at the results more specifically, but I have to say, there were very few of them. The average level of education for the laborers is around 6 or 7 years of education.
Thank you, Dr. Fernandez. I want to move to another question. And thank you, Dr. Fernandez Sanchez, for asking those questions. Kenneth Marthason asked, have there been discussions with sobadores? Many go there to get stabilized. They don't want to work comp case. They're afraid of deportation or other consequences. That's open to anybody in the team.
Okay, I'm gonna try and answer that. I have heard a comment that when they get injured, they go to sobadores, but this is not a group of people that we have partnered with. But thank you for the suggestion. This is very interesting because you're absolutely right. Many of them do not go to the doctor for fear of deportation. So thank you very much, and we'll keep that in mind.
And we have also, we worked closely with Gresen. To answer your next comment, you stated that there are great findings that we should team up with lawyers or nonprofits. When a jornalero directs other people what to do, he might be sued by an employer, at least in California, and we are trying to guide them as well in that same direction, if I'm not mistaken, Dr. Fernandez. We try to get them connected to social services in which they might receive legal and financial help, especially if they're victims of wage theft. Okay, the next question. Okay, and this is also by Dr. Fernandez Sanchez. As a social justice advocate, I wonder if there are any strategies to help those participants that reported injuries and did not receive health assistance from their employers. Did we have any free or low cost clinics that we partner with?
I don't see the question. Okay, yeah, I see it right now. Oh, yes. This is very interesting, a very interesting question. And that is something that we're dealing with, Dr. Fernandez Sanchez. Right at this moment, we're trying to understand what, if anything, can be done to provide assistance to community clinics. So I was reading the entire thread. Somebody was answering the question of whether or not the employers provided assistance to injured workers. Unfortunately, I would have to say that is a very small minority of employers who actually provide help to the workers. And we have been working very hard to establish a navigation protocol to help workers go to community clinics. This is something that we are trying right now. We are in discussion with several community clinics around the city, and we have been trying to navigate 5 day laborers on a pilot basis, and we are planning to follow up on those strategies, but at this point in time, we do not have a clear way to navigate, because navigation for the workers, it's complicated. It's actually much more complicated than we expected, and everything is contingent on their ability to get a job for the day. If they get a job for the day, that's their highest priority. And other than that, we are developing other strategies to help them when they get injured.
Again, thank you, Dr. Fernandez. We have time for one more question, maybe 2. So if you could put them up in chat, we would select one as they come. And I think this is for Dr. Aguilera. How do you plan to show the impact of environmental factors on workers? Do you have outcomes that are self-reported to show the impact of PM 2.5 on worker health? Did laborers report increases in asthma that may have affected their ability to work?
This is currently on our next steps. We barely started to looking into the environmental impacts just based on the field observations, but we have yet not engaged day laborers with the topics or assess their individual risk. There's some previous data that we're going to be looking into and more generalized information, but it is certainly within our scope to look through the future and then see if we can assess these health risks.
Okay. And I think this is kind of like a connecting to the one, it's not employers, but homeowners responsible. Like it's asking, are homeowners responsible for injuries to day laborers?
So this is Celeste. So I know in California, there's a law that homeowners who hire contractors have to carry workers' compensation. But that's not the case here in Texas. In fact, employers of any sort can opt out of workers' compensation.
Okay. We have 2 minutes left, so I think it's time to close the webinar out unless somebody has one more really pressing question that they would like answered. It can be through video or through chat, whatever suits you best. Okay. Well, thank you everybody for joining us. We appreciate y'all for coming and hearing us talk about the progress that we've made throughout the project and the work that we have done. If you have any questions, please contact Dr. Fernandez Esquer or Dr. Cesar Pinzon Gomez. They will happily answer anything that might come up. And again, thank you for joining us this Thursday afternoon.
Thank you, everyone.
Thanks, everyone.
Thank you, Azucena and Susana.
Gracias.
Muchas gracias.
Thank you all. Take care.